Hi, welcome. If you landed here because you're struggling with fatigue, weight issues, insomnia, anxiety, depression, women, if you're struggling with irregular menstrual cycles or really painful cramping or really bad PMS or horrendous menopausal symptoms, men, this talk is for you too. If you're struggling with poor muscle tone, maybe low motivation and drive, maybe excessive, emotional responses that aren't normal for you, then you've landed on the right spot. And today we're going to dive into one of the functional tests that we run very commonly to help us identify and fix the root issue in order to restore long-term optimal health.
Okay, let's share a screen with you and you're going to take a look at our hormone panel.
All right,
Here we go.
So what we're looking at here is what we refer to as a salivary hormone test. This looks at the most important steroid hormones, also collectively referred to as the stress and sex hormones. These include cortisol, which is our primary stress hormone, and then estrogen, progesterone, testosterone, and some of their precursors. One of the benefits to running a salivary test as opposed to a blood test, particularly when we're looking at cortisol, is because one of the most important values of cortisol is looking at its pattern throughout the day.
I'm going to show you that.
Yep.
Right here.
So cortisol, and we'll get into the glaring abnormality that we see here, but cortisol does a couple of things for us. One, it sets our circadian rhythm. So every cell in our body, every single cell, our entire body responds to the day-night cycle, right? The diurnal cycle. Cortisol is supposed to be highest in the morning in order to wake us up with the sun, and lowest at night in order to help us go to sleep when the sun goes down, okay? So that's how it helps set our circadian rhythm. Just to plant a seed, this can become imbalanced. We see this a lot in shift workers, for example. Nurses, police that have to work the night shift will start to see the circadian rhythm become imbalanced. And it's not just like, cortisol's off. It means the rest of our body's not responding to that circadian clock. It paves the way for a lot of issues. So nonetheless, cortisol, highest in the morning, lowest at night. In addition, cortisol is our primary stress hormone. So what I mean by that is that there's actually 3 different categories of stress. And the body, hormonally speaking, has one stress response mechanism. So the 3 different categories, most people when I say stress, they're thinking of emotional stress. And that absolutely applies. So day in, day out stressors like traffic and deadlines and juggling work in a family, up to, pretty significant stressors like a divorce, the loss of a loved one, financial issues. Those are some examples of emotional stress. The second category is physical stress. So physical stress, you break a bone, sprain your ankle, traumatic brain injury is a very significant example of physical stress. And then the third category is chemical stress. So chemical stress, now we start to get into things like food sensitivities, toxicity, hormone imbalance, like we'll see here, an imbalance of the gut microbiome in our intestines. These are some examples of chemical stress. So I mentioned 3 different categories, one stress response mechanism.
Which I think with the physical stress too is important is it doesn't have to be an injury. It can be those individuals who are racing marathons, Ironmans, right? Yes. Chronic exercisers.
Yes.
We're going to see that like you're just physically moving your body. We see a lot of disruption with this test with athletes.
Absolutely. Yes. Overtraining is a very real thing.
It's so real. Hi.
Yes. Right. Yeah. We've been there.
We've been there. But we have been here on this test, and we're going to share our personal experience with it as well.
Yeah.
So one stress response is what we have.
Right.
But we have multiple external or internal stressors.
Exactly. So what that means is from a hormonal perspective, the body doesn't know the difference between having a low-grade underlying infection and having a deadline. It's going to elicit the same response that we'll see here, which raises our question when we see cortisol off, like we do here, where it's high, what is it responding to? What are the stressors? Emotional, physical, chemical. The goal is not just, oh, let's just lower cortisol. The goal is to identify what it's responding to, help remove those stressors or rebalance them so that the body can go back to homeostasis on its own, balance on its own. Okay. So in this case, to briefly talk about cortisol here, we see that it's high, like we saw in that graph, and like we see the levels here. It's high in the morning and then eventually finds its place back to normal later at night. This person would experience sometimes insomnia in the middle of the night. So, we start this reading in the morning, but it doesn't say we know when cortisol started rising. So her insomnia at 3, 4, 5 a.m. was most likely mediated by cortisol. And that could be, that's where we start to dig a little bit deeper in each person's case. Is it stress from work? Is it stress from their family life? Is it stress from an underlying infection they have? Food, what does their diet look like? So we dig deeper here, but I want to plant that seed to say that's what the significance of this cortisol response is, and then how can we help that individual specifically.
And this one is pretty significant. So this patient is pretty significant up until about that 5, 6, maybe 8 o'clock period. Okay.
Exactly. And to talk about how this feels, what this means,
we want you to know what to look for.
What to look for. This can mean either like grogginess and difficulty upon waking in the morning, or it can also mean just up and almost an anxious kind of feeling in the morning.
Fight or flight.
Fight or flight.
Bing, gotta go. Really edgy, internal tremor. Yes. Exactly. When everything is fine. Like no particular reason.
Yeah, exactly. It can mean sleep issues, as I mentioned, insomnia, difficulty falling asleep, or difficulty staying asleep. It can mean craving salt. It can mean craving sweets. It can mean water retention, getting sick all the time. Could be gut issues like acid reflux or bloating, puffiness, other hormone imbalances. So that's to give you an idea. That's what cortisol can mediate and how it can impact how we feel.
It's a powerful hormone.
It really is.
Okay. Melatonin. We hear a lot about the melatonin too, and a lot of people are taking melatonin.
They are. So melatonin is our primary sleep hormone. It has an inverse response to cortisol. So it's lowest in the morning with the sun and highest at night. We start releasing melatonin in response to darkness. So artificial light can help suppress melatonin. In this particular individual, she was actually supplementing with melatonin.
Those are high numbers.
Probably because of the high cortisol. But she would supplement with 1 milligram of melatonin at bedtime underneath the tongue. And that can actually play a role into those cortisol readings we were seeing before, but nonetheless, that requires more of a bio-individual approach. But the higher levels of melatonin that we're seeing here is due to the supplementation. So it's high in the morning because it's still in her system, and it's high, but you see almost half of what it was at night because it's getting out of her system, but nonetheless, she's going to supplement with it that night too. Okay. If we see low melatonin in some of these tests, which is pretty common, my first thought is, what is cortisol doing? Second thought, what are some of these other hormones doing? Third thought is, what do nutrients look like? Do we have the nutrients to produce melatonin? And then fourth is, what is light doing?
Light is so key.
Light is huge.
Right. We're all inside. We need natural light to the skin, to your eyes, right? We're walking around in our sunglasses and we forget to take those off and actually get sunlight through your eyes back to the pineal gland to help naturally regulate your melatonin levels.
Exactly. And is the person looking at artificial light before they go to sleep?
Yes.
So a computer, our cell phones, TV, lights in the house, all of those will trick our brain into thinking it's daylight, so then we don't release melatonin, so then that affects our sleep. So just some things to consider.
All right, let's start looking at some sex hormones.
All right. So we collectively refer to the sex hormones as all three types of estrogen. There's three. Men, I'm talking to you too. Estrogen, progesterone, and testosterone. So these really, we find a lot of balance. Again, this applies to men and women. So we're going to start with estrogen. As I mentioned, there's three different types of estrogen, and they're more predominant depending on which phase of life we're in. So estradiol is the most potent and most dominant estrogen in menstruating women. Estrone becomes more dominant in menopausal women. Estriol is two things to consider with estriol. One, it's more dominant in pregnant women. Second, it is our detox form of estrogen. So when we detox estradiol, we detox it into estriol before eliminating it.
So like the breaking down process.
Breaking down process.
Right.
Yeah. So in this case, this test was run on a menstruating woman. And so we're primarily looking at estradiol, but we want to look at all of them, right? We want to look at the balance. How's the person detoxing it? Are there any excesses or deficiencies? And we want to relate that to progesterone, which I'll speak to in a minute. So estradiol, in this case, estrone looked fine, estriol looked fine. Estradiol in this case, we then look at which phase of the menstrual cycle for women. We're looking at which phase of the menstrual cycle she's in. Is it pre-ovulation or post-ovulation? Because those readings will make a difference. In this particular case, we're looking at post-ovulation, pre-menstrual cycle. So about 7 days within the menstrual cycle, about when those PMS and hormonal symptoms start coming on, which is why we bring in it then. And we see here that she's just 0.2 above that ideal range for estradiol. So we refer to this when estrogen is high in and of itself, or if estrogen is normal and progesterone is low, which we'll talk about in a minute, we collectively refer to this as estrogen dominant. So in this case, it's both. Estrogen is high in and of itself, progesterone is low. So what does this mean? Estrogen is a proliferative active hormone. That means when estrogen is high, common symptoms associated with this are weight gain, bloating, like a puffy feeling, abnormal periods, or the periods might be normal, but they're really heavy, really intense, really heavy cramps. PMS is really severe. Those are things that we'll see oftentimes in women with high estrogen. In men, kind of similar, minus the menstrual aspect, obviously. But in men, we'll see weight gain, inability to build sufficient muscle tone, inability to lose weight, possibly more emotional than you usually are. So I'm not saying emotions in men is a bad thing. But if you're, let's say, for example, tend to be more stoic and you find yourself crying at commercials or teary-eyed at different conversations or events, or, more irritable or less motivated, less driven, then we can look at estrogen, and high estrogen can relay that in men as well. Man boobs, gynecomastia. This is a real thing too. Again, we're going to look at estrogen. One seed I want to plant for men, where high estrogen comes from. Often we'll see this with low testosterone. The reason is because testosterone is converted into estrogen.
Under high stress.
Yeah. Under blood sugar issues. Mm-hmm. So you convert your testosterone into estrogen, which creates this perfect storm of hormonal imbalance. Okay.
Progesterone. Love it.
Yes. So progesterone is I mentioned estrogen is active proliferative hormone. Progesterone is the opposite. It's calming, soothing, nourishing. It's supposed to get the uterus ready for egg implantation, if that's going to happen. So it creates this kind of nourishing, calming environment. Obviously, if egg implantation doesn't happen, if you're on birth control, that's prevented. Nonetheless, progesterone, if it's low, what does that mean? Going back to especially those estrogen dominance type symptoms, similar to that, so everything I mentioned before, but then we also want to weave in some important factors. Anxiety is huge.
Huge.
Irritability, So women that are listening, if you just want to rip someone's head off around your menstrual cycle, if people steer clear of you because you know you're going to be so irritable, if you're anxious and have these racing, uncontrollable thoughts,
right?
Think of progesterone. Really strong cramps. Ladies, I know that we kind of joke about this being normal. PMS, cramping is normal.
Doesn't have to be.
It's not.
No.
It's a sign of dysfunction. It's a sign that there's an imbalance. We really look to progesterone for this. So you see here, this person was in the second phase of the cycle. We refer to this as luteal, a week out from their menstrual cycle. The range is 80 to 270. She was at 60, so we consider that low. Now, we can dig deeper. We can get into what's causing the low progesterone. There's many different factors to consider here, from gut health to cortisol to nutrients. But nonetheless, in this case, there's a couple different ways that we can address this. There's some herbs we can use. We can mitigate the stress response. We can provide some nutrients. Even temporary supplemental progesterone may be helpful depending on the person's age, their goals, and what we're looking for, and the severity of the symptoms too. Okay, even if we use temporary supplemental progesterone, we're not losing sight of that question: why is the progesterone low? So we're going to keep working on those factors, but we want to get the person feeling better in the meantime too.
That is a big one. I think this is one that we hear a lot from clients, right? The anxiety, the short-tempered, just this internal intensity, tension.
Yeah,
exactly.
It is.
Exactly.
Yeah, just like that tightening of the chest, the hypersensitivity.
So please know that it is worth looking into.
It is. It is. You do not have to suffer.
No. All right, here's breaking down different view, adding on testosterone and DHEA.
Yes, so the other ones we have talked about, DHEA and testosterone. So DHEA is our precursor hormone, and we'll see that in just a minute. What I mean by precursor is our steroid hormones. So all of the hormones we're talking about here, we refer to, they're in a steroid composition. It's really what that means. But nonetheless, it starts with cholesterol, which is really important to know.
I'm going to show you guys this.
Yeah, let's look at the graph
this
here.
This is important.
So this is our steroid hormone cascade. As you notice here, it starts with cholesterol. So pausing here for a minute, cholesterol has been villainized for years, decades, right? Never want high cholesterol. Too much cholesterol is a bad thing. Avoid the eggs, avoid the red meat, avoid the bacon. Lower cholesterol, the better. It's false. We need cholesterol. Every cell in the body is comprised of cholesterol, and it provides the backbone from which all of our steroid hormones are built.
I mean, take a look at this, right? Cholesterol to pregnenolone, and then all of this.
Everything else
needs to come from your cholesterol. Super important hormone.
Yes. So correct. Too much is not a good thing. Again, ask why. Why is there too much cholesterol? Too little is not a good thing either. So there's ranges that we use to evaluate this. We look in blood work, we cross-reference to see, do we even have enough backbone to be making the rest of our hormones from? So that's one factor I wanted to bring up. Next, you'll also see DHEA. DHEA, as I mentioned, is one of our precursor hormones. So DHEA, it's often referred to as an anti-aging hormone for a few different reasons. Has really powerful antioxidant, anti-cancer properties in and of itself, but it also helps us be able to produce the optimal levels of the rest of our hormones: estrogen, progesterone, testosterone, and cortisol. So we see in this person, DHEA is great. It's mid-range. DHEA looks normal. If DHEA is low, then we start to look at chronic stressors that have been going on for a long time and the body's becoming depleted. If DHEA is high, like in this case, we see androstenedione, very similar precursor like DHEA. If it's high, then we see there's probably an active stressor going on and the body is responding accordingly.
Like an infection?
Like an infection, like emotional stress,
a trauma.
A great example. Yep, exactly. Okay. And then lastly, we'll point out testosterone. So testosterone, again, women, I'm talking to you. Men, obviously, I'm talking to you. Both sexes, we have all of these hormones. Estrogen is just as important in men as it is in women, and vice versa. Testosterone is just as important in women as it is in men. They're just dominant in one or the other. So testosterone, in this person, it was normal, kind of mid-range, if you will, at 16. So in this person, it was normal. But let's talk about what low or high testosterone looks like. Low testosterone in men and in women, we see low motivation and drive, low energy,
No muscle tone.
no muscle tone. Yeah, so you might be exercising, but you can't seem to build the muscle. It's not responding the way that you would expect based on your efforts. Weight gain goes along with that too, right? Because if you're not able to build muscle, more than likely you're going to have an excess of fat. And that also gets me into the metabolic rate, so slow metabolism. Again, we see that in men and in women. Talking about high testosterone, same thing, men and in women, it's going to show up a little bit differently. And women will see possibly facial hair growth. I know that sounds weird, but it's actually pretty common. Might see facial hair growth, might see body hair growth, specifically the thick black hairs. Might be some irritability, some other like acne we see very often in women. Those are some common signs of high testosterone. In men, high testosterone, same thing, we might see acne. We might also see irritability, anger, hostility issues. So, the typical always wanting to get in a fight, always, quick temper, quick to set off kind of behavior. So too much, not a good thing. Too little, not a good thing. In men and in women, we want this to be balanced. Now, if it's low, is testosterone supplementation, just like talking about progesterone, is that the immediate answer? Not always. So if the symptoms are significant and they're really impacting daily life, absolutely, sure. Working with a doctor to help with testosterone, it is a prescription, so we would have to work with a doctor, but that may be the trick to get you feeling better while we're figuring out why your body wasn't able to produce testosterone on its own. So some examples of that could be chronic emotional stress, might be a long-term underlying infection, low-grade underlying infection, might be nutrient deficiencies. Blood sugar is huge for this, gut health. So there's a lot of different things that we can look at to help your body address those and then help your body be able to produce its own hormones normally. But like I said, in the meantime, sometimes supplemental use of these hormones can be helpful in order to get you feeling better, and we can work with the doctor accordingly.
Ultimately, it's finding what's going to work best for you.
Exactly.
Using a combination of everything that we can possibly get our hands on, right? It could be clinical, it could be holistic, and everything in between.
Exactly.
To restore your health.
Yes. And the bottom line, what it comes down to is if you're watching this video and you have been struggling, sometimes for years, but if you've been struggling with bloating, weight gain, anxiety, depression, insomnia, brain fog, all of these acne, overt hormone imbalance. So men, the low motivation and drive, the possibly formation of male breasts, the inability to build muscle. In women, horrendous menstrual cycles, or even just dysfunctional. If you have PMS or cramping, or if you're into menopause and still having hot flashes, still having weight gain. This is to say it's not all in your head. There's something that we can do about it. And we use tests like this to identify the root cause in order to fix it and restore optimal health long term.